Good afternoon, Nighthawks. Hey, Dr. H here. Wanted to go through the last two chapters of the semester. So, chapter 19, which you see here on your PowerPoint, the art of delivering patient-centered care in technology-laden environments. And at the end of the day, this is what we're working toward. We're working towards creating a more patient-centered care environment, reducing health disparities, eliminating health inequities. And this is one of the items that we're going to use to move in that direction. Chapters 19 and 20 are very short, but they're very important. Um, let's take a look here. The things that you'll want to know when you move out of chapter 19 and into chapter 20 is make sure you understand how to explore caring theories as they apply to the art of practice. Acknowledge the potential disruption of technology to the therapeutic provider-patient relationship. So we want to make sure that we're using technology as a good thing, not a disruptive thing. Define caring presence and suggest strategies to enhance caring presence. These are things that you should be able to have the concept of. And when we discuss caring functions up, and before we go any further, chapter 19 is page 371 in your book, 371. And caring functions may be less visible than physical interventions, include therapeutic communication, active listening, touch, and mindfulness, and help patients to maintain, enhance, or restore their health. You're going to find this on page 372 of your text. So you can get a little further reading. Technology in care environments, we've pretty much have covered this in several of the units. Smart pumps, EHRs, smart watches, in-home monitoring, and of course, the benefits of the technology. It increases efficiency of healthcare, promotes safety, and streamlines the work of nursing. Takes a little bit of load off of our overloaded nurses and puts a little bit on the patient. And at the same time, the patient becomes more invested in their own healthcare. And this is a win-win for everyone. We're going to skip down to Watson's theory of human caring. Um, Caring is healing consciousness and intentionally to care and promote healing. Caring consciousness is energy within the human environmental field of caring moment. You're going to want to know this. Um, this may come up, it may not, but this is something you want to take with you moving forward. Just understand what caring is and what healing is. Um, You can kind of go through the Caritas process, and I'll let you read this. You don't need me to read this to you. Um, at the end of the day, we want to think about the patient encounter. Uh, were you fully present in the moment and conscious of the individual and his or her uniqueness? Are we giving the attention that our patients deserve? Did you smile and greet the patient by name and acknowledge visitors? Um, when we're dealing with patients, for those of you who've had to work retail, they say the most important thing is that you can acknowledge the customer within the first 8 to 10 seconds of them entering the establishment. It is no different with patients. They want to know that you're there, that you're involved, and you're invested in their well-being. And the best way you can do that is smile, greet, a good bedside manner, if you will. Make sure you're listening to their concerns and give them the opportunity to ask questions. And did you explain what you were doing with and for the patient and why? Um, I understand that you may not, some of you may go on to do nursing and some of you may not, but you still may be in a situation where you're collecting information, and that's why this is equally important. We want to make sure that technology does not disrupt the process of the patient receiving healthcare. Um, Does the technology create a barrier between you, the patient, and the patient's family? Are they uncomfortable with the technology you're using? Did you not explain what you're doing with the technology you have? Things of that nature. Did you depend solely on monitoring technologies to create your interpretation of the patient's experience? And we don't want to do that. We want to ask the patient questions. No one knows the patient better than the patient. And that's really all there is for chapter 19. It's pretty short and sweet. There's a lot of good, valuable information in chapter 19. Chapter 20 which starts in your book on page 381, and it's the last chapter of the book. What? Chapter 20, generating and managing organizational knowledge. And there's some key terms. And if you've noticed, I haven't really gone through the key terms in prior lectures or videos, but I do want you to go through these. Uh, Data, health informatics, information technology, knowledge acquisition, knowledge domain process or KDP, knowledge management system or KMS, and knowledge users. And these are some of the key terms that I want you to know. Now that is on your in your book on text page 381. And this is a foundation of knowledge model. I want you to learn this. You will use this in future courses, and you very well may use this later on and explaining items to other individuals. And this just shows you how intertwined knowledge acquisition, dissemination, generation, and processing is, and where the feedback comes from. And so I want you to learn this model. There may even be a question or two on your next exam. And here it kind of explains in detail the foundation of the knowledge model. I would rather you go to your text rather than the PowerPoint. In the text on page 382 and 383, it goes into a deep dive on exactly what the knowledge model is. You don't need to know it inside and out, but you want to know what it is, what it represents, and have an understanding of it. Um, the nature of the mo not the nature of knowledge. Knowledge is the thought of as either explicit or tactic knowledge. Explicit knowledge is the knowledge that we can convey in letters, words, and numbers. Tactic knowledge is individualized and highly personal or private, including your values or emotions. These we need to know the difference between these two. This is very important for what we do and conducting our data analysis. Let's see. Let's skip down to slide number 11, collaborating to build knowledge. Joining a professional practice council goes a long way. I know a lot of you are busy, but joining a practice council, there's Cahims, there's HIMSS, there's the Gerontology Society of America. There's American Medical Association, Southern Gerontological Society. There are so many different societies and councils that you can join that deal with healthcare and gives you an opportunity to collaborate and learn from others, and others learn from you. Joining a community of practice, a COP approach promotes a social learning environment with strong component of engaging, sharing, and co-creation of knowledge. The more knowledge we can share and pass on, the better off everyone is going to be in eliminating health inequities, reducing health disparities, and making healthcare more efficient. Interprofessional collaboration, I want you to know and understand this. You will find this in your text on page 390 and 391. Supported by EHR, described as the magic at the intersection. HI tools and technologies can help to ensure that the perspectives of all professionals are heard and valued. And this is very important. We all have different backgrounds. We all see things from different ways. And by coming together, we can combine our experiences, our knowledge, and our past, and make a better and more efficient healthcare environment for everyone involved. The rest of this you can read on your own. I do want you to understand informatics and analytics. This is very important for the field we're in because this is the field we're in. Structured and unstructured data are mined for new clinical understandings that are rapidly implemented to improve patient outcomes. And that is what we're going to do. We are going to look at data. We're going to look at information. We're going to analyze it, and we're going to find better ways to provide healthcare for our patients, better ways to assist and aid our first responders, our nurses, doctors, and what have you. And basically, as a result of reading this book, you should have a deeper understanding of knowledge and informatics and the power they have to inform the science of your discipline. Um, and that is really all there is to chapters 19 and 20. This is two very short chapters. I'd like you to make sure you read through those. These are two chapters you don't need to know inside and out, but I do want you to know or understand if it comes up in conversation or when you see it in another course. Other than that, that is it for today. This was a short one. And here's my PSA. All quizzes and exams, including midterms and finals, are due at noon, noon, noon. That's in bold too, like uppercase bold, noon. If you have any questions or concerns, please reach out and let me know. I'm always here for you. Other than that, have a fantastic Nighthawk Nation. And you are almost done. You are at the end. You got this. And if you have as much faith in you as I have in you, you're going to do fantastic. Have a nice, wonderful day, everyone. Bye bye.